Imagine doing everything right. You go to an in-network doctor, you show your insurance card, you get routine labs drawn during your appointment, and then 2 weeks later, you get hit with a $2,000 bill because your samples were sent to an out-of-network lab. Sounds shady, right? Well, it's complicated, and that's exactly what I'm here to answer on a new series called You Asked, I Answered, where I answer some of your most pressing and confusing questions about health insurance from Reddit to help bring you clarity and save money. Hey, I'm Shami. I'm a healthcare finance consultant, and this channel is all about helping you understand your healthcare to save money. So if that's something you're interested in, please subscribe down below. So here's a shortened version of what OP wrote, which I'm reading from my laptop. Doctor sent my bloods out of network and I have received EOBs saying that I owe over $2,000. This was my first time visiting this doctor for a free annual checkup. I live in New York. Do I have grounds under the No Surprises Act to dispute/appeal the lab bill when it comes through? My doc never said anything about sending the labs out of network. This is very stressful. I hear you on the stress, OP, because most people assume that if they visit an in-network doctor, then everything connected to their visit, including their labs, is also automatically in-network. But that's just not how healthcare works in the US, and here's how I would approach the situation. Since the core issue is whether the out-of-network lab charges are protected under the No Surprises Act, the first thing I would normally check is whether you signed a notice and consent form agreeing to receive out-of-network services and giving up your protection from unexpected out-of-network bills. However, there are exceptions when the notice and consent form does not apply to non-emergency services, and I believe your situation is one of them. Per this decision tree on CMS.gov, the No Surprises Act protects patients from unexpected bills involving out-of-network providers connected to care received at an in-network facility, especially when it comes to ancillary services like lab work. I would argue that your doctor's visit was the in-network medical care you received, and that the processing of your out-of-network labs was care you received in connection to your visit at an in-network facility. Furthermore, CMS guidance states that the notice and consent exception cannot be applied to ancillary services, which includes laboratory services. So, because of all of this, I would file an appeal. Additionally, the fact that it happened in New York protects you even more because New York has additional state-level surprise billing protections beyond the federal law, including protections when an in-network doctor refers patients to out-of-network providers. Now, I can't guarantee that the appeal will automatically work, but I absolutely think it's worth challenging instead of immediately assuming you have to pay the full amount, or even before looking into asking your doctor's office for a reduced payment, a payment plan, or financial assistance programs if you need them. To file the appeal, you'll want to complete all forms required by your health insurer and submit any additional information that you want them to consider, including material from the federal or state government containing language about when the No Surprises Act applies, which I'll link to down below. And here's the biggest lesson for anyone watching. Never assume that having an in-network doctor means that your labs are automatically also in-network. Before getting blood work, ask the assistants at the checkout counter, which labs are my samples being sent to? Can you please confirm if the lab is in network with my insurance? And if they can't confirm that, then ask them, can you please provide me with the lab prescription so that I can go to an in-network lab myself and have the results sent to you? Because those few extra questions can end up saving you a lot of money down the line, especially if the labs you're getting drawn are part of the preventive services offered by the ACA for free, like cholesterol screenings. Have you ever gotten a medical bill you totally weren't expecting? Tell me what happened down in the comments below. And for more ways to save money on healthcare, check out this video right here. Enjoy.